Vitamin D deficiency is a widespread health concern that can have significant implications for overall well-being. This condition occurs when the body does not have enough vitamin D to maintain optimal health, leading to various physiological issues. Understanding the causes, symptoms, consequences, and management of vitamin D deficiency is crucial for individuals seeking to improve their health and prevent associated complications. Vitamin D is a fat-soluble vitamin essential for numerous bodily functions. It plays a critical role in calcium and phosphorus metabolism, which are vital for maintaining healthy bones and teeth. The body can produce vitamin D when the skin is exposed to sunlight, specifically ultraviolet B, UVB rays. However, various factors can limit the body's ability to synthesize this important nutrient, leading to deficiency. One of the primary causes of vitamin D deficiency is inadequate sun exposure. Individuals who spend most of their time indoors, live in regions with limited sunlight, or cover their skin for cultural or religious reasons may not receive sufficient sunlight to produce adequate vitamin D. Seasonal changes can also impact sun exposure, particularly in higher latitudes where sunlight is less intense during the winter months. Dietary intake is another critical factor in vitamin D status. While some foods naturally contain vitamin D, such as fatty fish, beef liver, and egg yolks, many people do not consume enough of these sources. Additionally, several fortified foods, including milk, orange juice, and cereals, provide vitamin D. However, not everyone consumes fortified products regularly, which can contribute to a deficiency. Individuals with certain medical conditions may also be at increased risk for vitamin D deficiency. For example, people with malabsorption disorders such as celiac disease or Crohn's disease may struggle to absorb vitamin D effectively from their diet. Similarly, those with chronic kidney disease or liver disease may have impaired conversion of vitamin D to its active form, further exacerbating deficiency. Another risk factor for vitamin D deficiency is obesity. Fat cells can sequester vitamin D, making it less available for use in the body. As a result, individuals with obesity may require higher amounts of vitamin D to achieve adequate serum levels compared to those with a healthy weight. Additionally, older adults are at a higher risk for deficiency due to decreased skin synthesis, reduced dietary intake, and potential mobility issues that limit sun exposure. The symptoms of vitamin D deficiency can be subtle and may not always be immediately apparent. Some common signs include fatigue, muscle weakness, and bone pain. In children, severe deficiency can lead to rickets, a condition characterized by soft and weakened bones, resulting in skeletal deformities. In adults, deficiency can lead to osteomalacia, which causes bone pain and muscle weakness, and is often associated with an increased risk of fractures. Beyond skeletal health, emerging research suggests that vitamin D deficiency may be linked to a range of other health issues. Studies have indicated potential associations between low vitamin D levels and an increased risk of chronic diseases, including cardiovascular disease, diabetes, and certain cancers. Furthermore, vitamin D plays a role in immune system function, and inadequate levels may increase susceptibility to infections and autoimmune diseases. Diagnosing vitamin D deficiency typically involves measuring the level of 25-hydroxyvitamin D, 25-OHD, in the blood. This biomarker reflects the body's vitamin D status and is commonly used in clinical practice. A serum level of 20 nanograms per milliliter, 15 mol/L, is generally considered sufficient for most individuals, while levels below this threshold may indicate deficiency. Management of vitamin D deficiency primarily focuses on increasing vitamin D levels through sun exposure, dietary changes, and supplementation. For individuals with limited sun exposure, increasing dietary intake of vitamin D-rich foods or fortified products can be beneficial. However, for many, supplementation is often necessary to achieve adequate levels. Vitamin D supplements are available in two forms: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol, with vitamin D3 being the more effective option for raising serum levels. Health authorities often provide guidelines for recommended dietary allowances, RDAs, for vitamin D intake. These recommendations may vary based on age, sex, and life stage. Generally, adults are advised to aim for 600 to 800 international units (IU) of vitamin D per day, while older adults may require higher amounts to maintain bone health. Regular monitoring of vitamin D levels is essential, particularly for individuals at higher risk for deficiency. Healthcare providers may recommend periodic blood tests to assess vitamin D status and adjust supplementation as needed. This proactive approach can help prevent complications associated with deficiency and ensure optimal health. Public health initiatives aimed at increasing awareness of vitamin D deficiency have emerged in recent years. Education campaigns encourage individuals to seek safe sun exposure, consume vitamin D-rich foods, and consider supplementation when necessary. These efforts aim to reduce the prevalence of deficiency and associated health risks. In conclusion, vitamin D deficiency is a significant public health issue that can lead to various health complications. Understanding the causes, symptoms, and management strategies for vitamin D deficiency is crucial for promoting overall health and well-being. By prioritizing sun exposure, dietary intake, and supplementation, individuals can work towards achieving optimal vitamin D levels and reducing their risk of associated health issues. Regular monitoring and proactive management are essential for maintaining good health throughout life. By raising awareness and encouraging healthy practices, we can combat vitamin D deficiency and promote a healthier population. Information. All information in this article has been compiled from open sources and shared for informational purposes. It does not constitute a recommendation or treatment. For more detailed information, examination, and testing, please consult your doctor.